Good afternoon, everyone, and welcome to our February Clearinghouse on Women's Issues Black History Month meeting. The Black History Month theme for this year in 2022 is centered on the importance of health and wellness. Part of the focus acknowledges the legacy of Black scholars and medical practitioners. So it is with our distinct honor and that we're proud to present to you today, Dr. C. Nicole Mason, President, CEO, Institute for Women's Policy Research. She was named one of the world's 50 its greatest leaders by Fortune magazine. She is also the author of Born Bright, A Young Girl's Journey from Nothing to Something in America. She will focus on women's health inequalities and the way to fix it. Prior to IWPR, Dr. Mason was the executive director of the Women of Color Network at New York University's Robert Wagner Graduate School of Public Service. She has also been featured on many major television shows and in distinguished media print. I must say that I read her story and I could relate to it very much as a young girl growing up in Texas. Our second speaker is Dr. Ethlyn McQueen-Gibson, Director for Center for Gerontology Excellence at Hampton University. A U.S. Army Nurse Corps veteran, she will address topics related to older women of color. She will address the topic of older women of color. Dr. McQueen-Gibson is a School of Nursing Associate Professor at Hampton, Board Chair of American Heart Association, member of the Governor's COVID-19 Long-Term Task Force, and the State COVID-19 Vaccine Advisory Working Group. She also is very active in community and has been featured in many popular news media. As you can see, we have two very distinguished guests that will present, and we're honored to have them. Following their presentations, we will also have an open question and answer session where you can ask some questions. So with that, I will welcome Dr. C. Nicole Mason. Dr. Mason.
Hi, I'm really excited to be here and to be with you all this afternoon. I first want to start out by thanking the Clearinghouse for Women's Issues for inviting me, and also Sue Klein for extending the invitation. For those of you who may not be familiar with our work, IWPR, the Institute for Women's Policy Research, is the nation's only and premier think tank focused on winning economic equity for all women and building women's power and influence in society. I am proud to be leading IWPR in this important moment that feels quite meaningful and pregnant with possibility. This moment provides us an opportunity to rethink systems and how we might go about creating a more just and equitable society and economy. Over the last 2 years and since the start of the pandemic, I've been working closely with my colleagues to really think about how we might forge a gender equitable recovery, identify systems gaps, drive solutions, and use an intersectional framework that gets at the heart of the economic disparities of women right now and in this moment. I want to be very clear that prior to the pandemic, many women were struggling economically. Many women were on the margins of the economy and society and really struggling to make ends meet. The pandemic that took hold in 2020 only exacerbated the economic, mental health challenges that many women were facing. The pandemic also really provided us a really interesting opportunity for us to really examine those deep cleavages, social inequalities, and think about issues related to, again, our healthcare system, our childcare system, the economy, what constitutes a good quality job. All those things came into sharp focus over the last couple of years. In the time that I have with you, I want to talk about this particular economic moment that we find ourselves in, and how it impacts women's economic security and their wealth. Um, um, So as you know, as I mentioned, the pandemic continues to have a devastating impact on women and families. At the start of 2020, we were celebrating a significant milestone. Women were 50% of the US workforce. It was a milestone not seen. The last time we'd seen such a milestone was 2008 in the with the Great Recession. But by March, all those gains, all those employment gains had been wiped out by the pandemic. In just a short period of time, women lost more than 4 times as many jobs as their male counterparts, and were employed in the hardest hit sectors: leisure, hospitality, healthcare services, and education. Women of color were disproportionately impacted by job and income losses, mainly because they're overrepresented in those hardest hit sectors. One of the other issues that was a particular concern for women in this moment, and remains over the last 2 years, is the fact that many of these jobs were lower wage jobs, meaning that women were earning the minimum wage and also had a lot of job insecurity. So when the pandemic hit, not only did they not have the economic support to be able to ride out the economic shock or the downturn, but they were also missing critical job benefits like paid sick and family leave, as well as job security and flexibility, which forced a number of women out of the workforce. In terms of thinking about a gender equitable recovery, we are still very far off. And when we think about what has happened over the last couple of years to women's, the loss of employment gains for women, but also the loss of earnings. So even if women did have savings to tide them over during the economic storm, those savings have all but been lost. Right now, in November 22, we are still down more than 2 million jobs for women compared to the same time the previous year. And before I talk about the wealth, I want to talk a little bit more about the impact of the economic downturn on women, including their career mobility and earnings. So one of the groups that is often overlooked when we think about the impact of the pandemic is younger women. So the unemployment rate for women at the beginning of the pandemic was around 4%. A couple months after, the unemployment rate, skyrocketed to 16 to 18%. For younger women, though, the unemployment rate hovered around 20%, and many women who had less than a high school education, the numbers were even higher. So what does that mean? That means that younger women who were just now coming into the labor market or just now starting their careers, they've had their careers derail for the last couple of years, which will have a direct impact on their future earnings and their career mobility. And then when we talk about the women who off-ramping their careers because of caretaking responsibilities in schools and daycare closures, that's also really having a significant impact on women's earnings, but also their wealth accumulation. So in August and September 2021, more than 865,000 women exited the workforce, many of them because of caretaking responsibilities. And what that means, again, is that when we know that whenever a woman off-ramps her career, whether it's for, to raise a child because of illness or other caretaking responsibilities like caring for an aging parent, it does impact their career earnings, and they have a hard time re-entering the market and recouping those earning losses. And in a recent IWPR survey, women said that they believe that their employers, that they face consequences for off-ramping their careers, or employers didn't take them as seriously as other workers because of their caretaking responsibilities or other, other issues. And so what that means is that does have a really big impact on their career mobility and their future earnings, especially if they're having trouble, moving up in their profession or in their career. And while when we think about women off-ramping their careers, we often frame it as a choice. Even when we were thinking about women who had left the workforce during the pandemic, there were a lot of articles written about women choosing to leave the workforce to take care of their families. But what we discovered in our research and in our work is that women really felt like they had no choice, especially for women who were not able to work remotely. Workers who were able to work remotely was a very small fraction of workers overall. And for those who had to show up to a physical location in order to get paid, they really had to make some really big choices. Critical choices for many women. They had to choose between earning a living and taking care of their families. And many of those women were women of color and women, employed in lower wage jobs. So really thinking about how we reframe the conversation around choice and understanding that this, for many women, these are constrained choices, meaning they're not really choices at all. So I want to connect the dots right now between women's mental health and what they've been experiencing over the last couple of years. One of the things that I think is really important is that the caretaking responsibilities, the experiences of women in the workplace, the discriminatory practices in the workplace, all those things we were not talking about publicly. Many of the conversations that we are now having about caretaking responsibilities, the lack of flexibility and control over one's schedule, the treatment of women in the workplace, those are all private conversations or happening in my work or your work, but now they are very public conversations. For the first time, we have CEOs of companies as well as grocery store clerks, women who are on the front lines, really talking about the constraints of the structure of the workforce and how it hasn't been it has never worked for them, and has taken a toll on their mental health and well-being. And so now we're in this moment where we can really think about what might a model workplace look like for women? How might we, make sure that workplaces are respectful of women's work schedules and also their caretaking responsibilities, and not seeing it as a special accommodation, but as the changing nature of work and who does it. We have a very antiquated workplace model that is very male-centered, and that privilege is being able to be 100% available. And so what the pandemic has done has, one, made these conversations possible, but also made it so that we can really start to think and reimagine our workplace, one, in a way that, again, is reflective of our workforce today, which we know is more than 50% women, one where women are, in many families, the primary breadwinner in their families, especially for women of color. So really being able to take into consideration, what life looks like for working women today. So both of these things, all of these things that I've talked about in terms of the impact of the pandemic, has an important, impact on women's long-term earnings and wealth. So one of the things when I think about wealth and wealth accumulation is, I ask myself, what could I do with $1 million extra in my pocket? And I think many people, that's a very interesting question to think about. And that's the question that many women will be contemplating at the end of their careers. As a Black single mother and the breadwinner in my family, I will have to work longer and harder to achieve the same markers of financial success, home ownership, savings, and wealth as most men. A woman who works from 16 to 70 will make nearly $600,000 less than a man working the identical span. For Black women, Indigenous women, and Latinas, the loss in earnings over a lifetime is significantly higher, in some instances topping out at $2 million. So when we think about this, and I think women, frankly, I mean, we just, and many, we don't think about the gender pay gap. And every year around this time, maybe next month, we start to think about the gender pay gap, and everybody floats the statistic of, women earn 84 cents on the dollar for every dollar a man earns, and Black and Latina women earn significantly less. And when you say it like that, it seems very, very abstract. But when you put it in real terms, again, that's less money I have to pay for my children's education. It's less money for me to sock into savings, pay down student debt, all of these things. It really comes into sharp focus. And then understanding that that is money, out of my pocket, every paycheck, every month, every year, until at the end of my career, it amounts to between $600,000 to $2 million. So the gender pay gap is a significant contributing factor to the wealth gap and wealth disparities for women, in the U.S. For all intents and purposes, since 1960, the gender pay gap has only closed about 20%. And if we keep at this pace, we will not close the gender pay gap until 2057. For Black women, it will take more than a century, 100 years to close the gender pay gap. And for Latino women, it's about 200 years. And so what that means, quite simply, is that my daughter and my daughter's daughter, if we do nothing to accelerate the closing of the pay gap, will not see pay equity in her lifetime, which, as we know, will impact her ability to accumulate wealth, to own a home, to sock away savings. And in times of economic shock or an economic downturn, it makes it harder for her to get to the other side. In terms of thinking about the causes of the gender pay gap for women, again, thinking about antiquated gender norms and expectations about women's skills, abilities, and talents. We all know this, that it's really in the water. Even when we think about the recent victory of the U.S. women's national soccer team, that was a really hard fought battle, mainly rooted in stereotypes about women's performance and whether or not, regardless of talent, they deserve to be paid what their male counterparts were paid for the same sport. So really chipping away at these gender norms and expectations, and also just giving a dose of reality. The fact of the matter is that women make up 50% of the workforce, are outperforming in many cases their male counterparts in jobs, and also are the primary breadwinners in their families. And so really also, in addition to countering, gender roles and stereotypes, also really, bringing in the reality of the matter about women's contribution to the workforce and also to businesses and companies across the company. The other issue here that, again, when we think about the wealth disparities, but also the wage gap, is pay secrecy and transparency. Although across the country there are laws that prohibit pay secrecy, many states do not enforce the rules. And so women are coming in and, regardless of their skills and talents, are still being paid less than their male counterparts, in some instances for the same job. And we always talk about the fact that, women should negotiate. So we hold all these courses or read all these articles about how to be a better negotiator. But the fact of the matter is, as soccer star Megan Rapinoe says, you cannot, outperform inequality. You cannot negotiate your way, around gender bias. And so thinking about how do we address the systemic and structural issues that are related to issues like pay transparency and pay secrecy for women. Another big issue that is contributing to the huge wealth gap for women is labor market segmentation. When we think about the pandemic and the overrepresentation of women in the hardest hit sectors, one of the things that's really important to know is that these are the jobs that were the were among the lowest paying jobs with zero benefits, no paid sick leave, no time off, no flexibility, no health insurance. And so and women of color are disproportionately in these sectors. And so when we think about an equitable recovery and we think about job creation, one of the things that we've been saying is that while we can make sure that women get into higher paying jobs like construction, manufacturing, we know that those jobs pay well. One of our tasks ahead of us is to make sure that the jobs that women are already in are quality jobs and pay well. The truth of the matter is that the idea of moving a number of women into production, manufacturing, construction will take a very long time and actually hasn't changed much since previous efforts, but we do know where the jobs where women are concentrated in. And so raising the wages of those jobs and making those secure jobs and quality jobs is the task I believe before us in this moment. So I want to leave and end with talking about some of the strategies I think would work in terms of wealth disparities and some of the things, and making it, giving women what they need to be able to not only re-enter the workforce, after the pandemic, but also be able to sustain employment. So the first thing, I just talked about was raising the wages of women workers. So raising the wages of women to match those of comparable men would have a dramatic impact on their families and their economic well-being, including wealth accumulation. The poverty rate, if we paid women what they are worth, the poverty rate for all working women would be cut in half, falling from 8% to 3.8%. The very high poverty rate for working single mothers would fall by nearly half, from 28.9% to 14.5%, right? Just paying women what you pay men for the same jobs would really be, a game changer here. The second thing I want to talk about, which we all know and say and think in terms of wealth accumulation, is home ownership. For many Americans, home ownership is the chief way to build wealth. And, historically, communities of color and women have faced tremendous barriers and hurdles to home ownership, including redlining and discriminatory lending practices. And also, I don't know if you've read recently that even once you're in the house, having appraisals, discriminatory practices with appraisals has also impacted, again, the accumulation of wealth for, Black and communities of color in terms of their home ownership. And we know because of these historic discriminatory practices, it has really very much impacted the wealth accumulation of Black women and families. And just as a personal anecdote, when I purchased my first home many years ago, I was the victim of predatory lending practices. Only I didn't know it. I was being charged a higher interest rate only because I was a Black woman. It wasn't until I received the notice from the bank or from the law firm saying that, they had reached a settlement with my lender that I became aware that I was a victim of predatory lending practices. And these predatory lending practices in 2008 at the Great Recession had a definite impact on the wealth accumulation and home ownership rates of Black women in particular. Many women, because of predatory lending practices, lost their homes in 2008. The good news is that, we did learn some lessons in this economic downturn. There were mortgage programs put into place to prevent, the loss of, home ownership for families. So, but when we think about, again, when we, put it into focus, the result of, predatory lending practices, lower wages, results into, very, very, very clear, bottom line disparities in terms of wealth. So Black women hold more than 90% less wealth than white men, and also compared to white women as well. And so again, when we think about building wealth and the strategies, we know that home ownership is one. Also, home ownership, raising wages, expanding employer-based retirement plans. One of the things we just did completed a research survey on retirement, the future of work and the benefits that employers provide. And while most employers do provide retirement plan, access to retirement plans, there are many employers, especially in lower wage jobs, that do not provide access to retirement plans or matches possible to employees. And so expanding employer-sponsored retirement plans is also a really key engine for wealth building. And the last thing that I want to say is really doing away with pay secrecy and pay transparency, especially at the federal level, passing laws like the Paycheck Fairness Act, which really gets at the heart of pay secrecy and the lack of transparency, and giving people the ability to discuss their wages and salaries without fear of retribution or any kind of retaliation. So, I do think there's a lot of work to be done here, but I'm really optimistic that, we're having conversations around work and wealth and wages that were not possible 2 years ago. And so we do have a really, great opportunity to really think about what might a just, fair, and equitable economy look like for everyone.
Thank you, Dr. Mason. Our next speaker is Dr. Ethlyn McQueen-Gibson. Dr. Gibson.
Good afternoon, everyone. I'm so excited to be here. And in my 15 minutes, I actually want to address a few issues with the women that are on the screen. So this is actually how I'm going to start out my talk with you. And I want you to remember this. So when I thought about this morning, I want all the women on the screen to think about it in this way. First of all, think about all of your roles. And when I woke up this morning, I thought about my roles. Number one, I'm a sister. I'm a wife. I'm a mother. I'm a daughter. I'm a veteran. And I'm also a grandmother. But then I thought about, as I rolled over in the bed, I thought about I'm sick, and I'm sick of being tired all the time. So when I thought about all of those things, I said, well, you know what? I've been a nurse for 40 years. And even though I've been a nurse for 40 years, what was I going to do for the second act of my 40 years of being a nurse? And so I've been in the hospital system for a long, long time. And so what was I going to do different for those next 40 years? And so I went back to school, and my daughters were like, Mama, now you already got a whole bunch of degrees. Now, what do you need another degree for? And I said, because I needed another degree so I could get a seat at the table to make a difference. And that is why I went from being Ethlyn McQueen-Gibson to being Dr. Ethlyn McQueen-Gibson, so that I could change for some people. And that's what I'm going to talk about today, is the Gerontology Center for Excellence, and how I want you to know what that is all about. And so I know that some of you received some handouts, and you are probably like, what the heck is a Gerontology Center, and what does that have to do with me being a woman? Now, every single one of you are going to become 40, 50, and probably 60, because I'm hoping that you're going to be healthy. So what does that mean? Every single state that you live in, believe it or not, has a gerontology center. Now, everybody probably knows what a pediatrician is, because you have probably had nieces and nephews. A pediatrician takes care of children. Well, geriatricians take care of people over the age of 55, not 65 but 55. And so a geriatrician helps tune up your body if you are over the age of 55. And a gerontology center, and you all have some handouts that talk about gerontology centers, okay? And what we do is we make sure that people actually have a better understanding of actually how to take care of people that are 55 and older. And I'm really glad that the person in front of me talked about how we can actually address some of the issues for older adults, because we have not been doing a very good job of that. And that is why some women are in the state that they are in right now. And so one of the things that really stood out for me as I was working in hospitals is that I saw that many of the people coming in hospitals, and especially those that are Black and brown and those that are of other vulnerable communities, that there were many issues that were surrounding financial literacy related to health issues and health literacy that landed them in the hospitals. And we can't deal with those issues when you're in the hospital because you are too sick and tired to really understand when we're trying to teach you in the hospital. If you're in the hospital and you have COVID-19, you just trying to breathe, right? We can't teach you anything when you're in the hospital with a tube down your throat. You're just doing your best to try to breathe and get out the hospital. If you're in the hospital and we're teaching you about your diabetes and your heart disease, you just try to get out the hospital and take care of your diabetes. When you need to learn about it is when you are out in the community. And so the Gerontology Center is all about trying to make sure that we are addressing those issues. And that is why Dr. Gibson is at Hampton University trying to make sure that that happens. So the Gerontology Center is about 4 things: supporting the workforce, number 1, because number 1, we need to make sure that we are building up a diverse workforce. We need more people that look like the people that we serve, because it does make a difference when you have people at the bedside that look like the people that you serve. So that's one mission of the Gerontology Center. Number 2, fostering partnerships. And I'm going to talk about a couple of those partnerships in just a little bit. Number 3, mentoring and supporting students. And I do a whole lot of that out in the community. And then collaborating and promoting research, because a lot of times communities don't know about research, and so they don't participate in that research. And there's a lot of research out there that's good research. All of it's not bad. And I'm actually a part of a lot of that research. I participate in research that's actually with COVID-19, with Alzheimer's, and I'll be sharing some of that with CWI. I'm actually right now participating in a research with 9 public housing projects. Every Thursday night on Zoom, I participate with 9 public housing projects, and we get on Zoom just like we're on Zoom right now, and we talk real stuff. Do you believe in COVID-19? Tell me what you hear out on the street. And they actually get paid for their time. And they're all ages, and we talk about it. So that's what we do from the Gerontology Center. And if they hear something, they call Dr. Gibson. And they tell me, they say, Dr. Gibson, have you heard such and such? And we've been doing that research for over 2 years. And when we started it 2 years ago, remember 2 years ago, there wasn't a vaccine, remember? And most of them were thinking they would never, ever take a vaccine. And guess what? Right now, all of them are now vaccinated. And that was because we had conversations through the Gerontology Center. So take a look at the handouts that I sent to you. The other handout that I sent to you is what is a curriculum. We are training young people to be gerontologists. Because you know what? A lot of our young people, they have no idea what it means to grow old. When my students actually started taking the classes on gerontology, do you know that most of them thought that when you get your Social Security check at the age of 65, they thought most of you were getting a check that was $5,000 a month. How about that? Are most of y'all getting a check that's $5,000 a month? I had to say, baby, hold on. I don't think your aunties and uncles are getting a $5,000 a month check. Okay, now hold it right there. Look at that. Now that is actually one of the adult centers that we go and visit. I actually take my students. Those are some of my beautiful students from Hampton University, and we go on field trips. And this is actually one of our centers in Hampton. It's called the Woodlands at Phoebus. And so we actually went out to one of those centers, and we actually had a tech day. And we went out, and many of the older adults, it's an independent center, and they had received iPhones and iPads for Christmas, and they didn't know how to set them up. And so we actually took time, scroll it back down just a little bit. And no, go back, go up a little bit, I'm sorry. Okay, right there. And they didn't know how to set it up. So the students actually showed them how to set up their iPads. And so that's what we did for a gerontology class. And we did intergenerational touch points. Now this was pre-COVID. And so that's what we do for our gerontology class. So how about that? So that's what we do at an HBCU. Okay, let's take that down because I only got a few minutes. Now, what else do we do? What else does Dr. Gibson do when she's out there with older adults? Let's talk about some of my partnerships. Let's talk about Project Nana. That's one of my friends for older women. Project Nana, you're probably thinking, what the heck is Project Nana? Let's put up the flyer that talks about seasoned women. Seasoned women. Now, that's one of the flyers. It's going to be the one that has the lady on it with the photo. There you go. A lot of older women, Project Nana, and I want you to go to that site. That's one of my partners, where women are still dealing with domestic abuse over the age of 60. And we have partnered with Project Nana. It is a 501c3 organization. And we actually talk to older women over Zoom, and there are small groups. And let me tell you something, we have some awesome sessions. We also talk to older women about taking your grandmother to the doctor. We actually then had a session just a couple of weeks ago where we talked about intimacy. Bring up the next flyer. And we even had another session. We'll bring up the next one because I only have a little bit of time. But it was a real live session. And then I even had my students to listen in to the session because I said, you know what? You think that older people stop talking about stuff? They still got stuff to talk about, okay? And we still need to take care of our older adults, okay? Because life doesn't stop after the age of 40 and 50 and 60, okay? But these are organizations that are still very, very important. This was the conversation that we had a couple of weeks ago. It's not all about sex, it's about intimacy, okay? And so again, these are partners through the Gerontology Center of Excellence, because again, we partner together, and there's my logo, because again, there's strength in numbers. And we work with our psychologists, we work with many organizations, but we partner together. And every single month, there's a Nana Chat, and that's what we call it, a Nana Chat. And so again, you can go to the website, Project Nana, but they're one of our partners through the Gerontology Center of Excellence. So today I'm just whetting your appetite so that you can kind of know what's out there. So how about that? So now let me go to the next one. Now, as women, we always running around taking care of everybody else, right? Now I'm gonna talk to you about myself. I was standing in front of my students one day, and one of my nursing students, she said, "Dr. Gibson, what's the matter?" And I said, "What you talking about?" She said, "Dr. Gibson, you don't look like, you don't look right. Is your heart hurting?" And I said, what you talking about?" She said, "Dr. Gibson, do we need to call 911? I said, what? She said, "Dr. Gibson, what's going on?" And I said, what? And one of the students was on her phone and she was dialing 911. I'll never forget, I was in Seattle, Washington, and she called 911. And by the time they got me to the emergency room, my blood pressure was 200 over 110. The teacher's blood pressure was 200 over 110. I could have had a stroke. This is February. And that is why now I serve as the chair of the American Heart Association in Hampton Roads, because I could have had a stroke. So do we as women take care of ourselves before we take care of everybody else? And the answer is no, we don't. We take care of everybody else instead of taking care of ourselves first. So sometimes we have to say no. So I just sent across to you what are the signs and symptoms of a stroke. And sometimes that means that you got to tell your children no. That means your grown children. Sometimes you got to tell your husband no, your boo no. Sometimes that means you don't have to answer the phone. I put my phone on do not disturb after 9 p.m. That means that sometimes I run away with some of my girlfriends and take a vacation. Okay. That means that sometimes I go spend the money. That means that sometimes I have the 3 cupcakes. It's okay. I keep it real. And I'm the nurse. It's okay. Because I could have had the stroke and then I wouldn't have been spending anything, right? So remember that. And then that's why now I'm living my life, right? I'm living my life and I am the grandmother. And remember what I said at the beginning? All of those things, right? I'm not going to be sick and tired of being sick and tired, right? Okay, now let me tell you 2 more things, okay? My other partnerships. My last one is chairperson. I was very blessed, and I think they sent you the link for grandparents raising grandchildren. I was very blessed. My project, when I went back to school, they said, "What would you like to do your project on?" I said, "I have too many of my friends that are raising their grandchildren." And so I thought I would do this little project about grandparents being parents the second time around. And so after I did the project, then I sent my name in to be a part of this project about grandparents raising grandchildren. And do you know, I think everybody probably on this screen knows somebody that's raising their grandchildren for a variety of reasons. And so on November 20th, I actually was very honored to be part of a group that sent a report up to the United States Congress with 22 recommendations of what needs to be done to support the millions of grandparents who continue to do that. And so please look at that report. And we continue to do the work. So look at that report. And actually, Senator Susan Collins and Senator Bob Casey, I was very blessed to sit in front of them. I would have never thought a little girl from Cleveland, Ohio would sit in front of them as a co-chair. But see, Remember all those roles I talked about at the beginning and about being sick and tired of being sick and tired? I ain't gonna be sick and tired of being sick and tired anymore because I'm gonna be a woman and do my job. But look at that report and remember all those hats. Everybody can wear those hats and do your part. And thank you for giving me a few minutes to just tell you that I'm very blessed to do those things. And CWI, thank you for giving me a few minutes to just tell you a few things that I've been blessed to be able to be a part of. Thank you so much.
Well, let's give them a hand. That was excellent, both of you. So which is it, the real HU or the real HU?
You already know what it is. I'm not gonna even, I don't want to even get into this with Dr. Gibson.
Dr. Mason is Howard and Dr. Gibson is Hampton HU. So they're both great schools. I commend both of you. Outstanding. So we'd like to open the mic for questions. What we'd like for you to do is to unmute yourself and say who you are and address your question to whoever. Open for questions. Jeanette, Ms. Esbrook.
Thank you. Thanks for arranging this. It's very informative. I have a question for Dr. Mason. The data that you mentioned that women make 84 cents on every dollar that a man makes. Can you develop an algorithm or a way of showing that that's just the beginning? Because we read about these raises and its percentages. When you start already 16 cents on every dollar behind, and you put a percentage on that year after year after year, a male who is making more but gets, let's say 5%, that continues to get bigger and bigger and bigger, and it ends up for somebody on a career track to be way more than 84 cents on the dollar. I'm sure you can do a graph to show it, and I think we need to be able to express that in some statistical way. Have you thought about doing that? Is there a way we can do that?
You know, Jeanette, I think that we don't even know the depth of the gender pay gap because we don't even have the data. We rely on the BLS data, the Bureau of Labor Statistics data, to tell us how big the gap is. But private companies or public and private companies are not required to share their pay data with us. So we you know, it could be much wider than we know.
Absolutely.
Which I believe that it is. And there's so many, you know, it's compounded, right? So we know the 84 cents on the dollar, but like you said, the 5%. But if you say, for example, we think about wealth accumulation, if my ability to buy a home is delayed by 5 years because of the pay gap, that's 5 years that I did not have the ability to build equity. So that's also, you know, a loss that is not calculated, or that we can't get at. And so, you know, in all these very small and insidious ways, the gender pay gap creeps in, and the cumulative impact of the gap is exponential.
Yes. I worked with some faculty back in the day when most of the professors at universities, HBCUs, state universities, most of the women were single women. They had to choose between, do they want to get a PhD and become a professor versus the traditional family. And many of the women were sympathetic to their male colleagues who were having children, raising families, and they would defer to them. They would say to the chair of the department, give him a raise. I don't have to buy shoes for children. It's just me. I can live on this. And at the end of the day, when retirement came up, they all of a sudden realized that their benefits on retiring back, when you had your highest 3 salary, they all of a sudden learned what their male colleagues were making with their own complicity, and they were in shock. And you have, at this particular university I was working in, they were going back and asking some of these female professors not to retire, that they were going to up their salaries for 3 more years so they could retire at a little higher. But it was really sad how sometimes women, in a very loving and team way, can be their own, I don't know, enemy may be too strong, but not help themselves.
Well, it's internalized sexism. Okay, we internalize, women internalize the messages around our value and our contributions as well. And, so like, I do think that complicit wouldn't be the word I would choose, but like, there are real structural barriers. And even, then when women would ask for raises, they would be turned down. They said, well, you have a husband. He's the primary breadwinner in his family. Or single women would be asked, do you have a family to take care of? You hear all these, hear all these, horrible stories that are still true today. But, the reality is that that's not our reality. Like, women are the primary, in some instances, primary wage earners in their families. And then, to think about like the long-term impact on retirement, for example. There's been, but I think, transparent compensation schemes, is, really important. We have one here at IWPR, and I think that that's a way to chip at some of this stuff, especially for same rank and position.
So what that means is what you were saying, that comparative salaries are more open and well known, and you can talk about it when you refer to transparent.
Yeah, transparent. So like a compensation scheme would be like, you use market-based information to determine the salaries of all people in your company based on position and experience. And so that would be transparent. So for a particular role, the maximum salary is $150,000. And if you have 2 years of experience, you get 135, regardless of whether you're a man or a woman. And it takes the negotiation part, because women usually lose out in negotiation, but it also takes the power out of the hands of the hiring manager, who might have their own biases.
Thanks. Appreciate that.
Any other questions?
I have a question, Dr. Mason. Can you talk a little bit about the union differential for women who are working? Because we've always been told there's about a 40% uppage. And the other problem is that employers insist on secrecy so many times about pay scale, and you can't fight something like that if you don't know what you're dealing with.
So I don't want to give you the wrong, percentages, but we all know that when women belong to a union, they're better quality jobs, but they also, have higher wages. And when we looked at pay secrecy laws across the country, we did that last year. What we saw is that, in states where there were anti-secrecy laws, meaning you cannot prohibit your employees from talking about salaries, they were still doing it, but it was informal. But if you belong to a union, that wasn't the case. So women who belong to union, didn't, the issues around pay secrecy were not there. And also, I think, women who belong to a union, they have recourse. If there's, discrepancy in pay, there's a way to address it. In many private and public companies, you're dependent on the human resources, department of an organization, which is working for the organization. So, so obviously union membership, women fare better when they are a part of unions in terms of their wages and also their working conditions.
Right, and women also learn to negotiate better, I think. One of the biggest problems, and I've seen this in my children, they're much better negotiators than I was. My daughters both have ended up with very good stuff because they knew well, one of them is now a manager, but was in a place with the union. But it's an amazing thing. It is. And I also had a question for Dr. Gibson. Dr. Gibson, the differentials in race on different health issues, how close are we to solving those? Is this something that can be solved? Because it's very, very disheartening to see the loss of young women when they're childbearing age from things that, look at the case of Serena Williams. I mean, that could have been a horrible story if it hadn't have been the person that spoke up for herself.
Well, again, a lot of those disparities have to do with increasing the healthcare providers of color at the bedside. And so again, that goes back to increasing the numbers of those students in healthcare careers. And so that is why we are trying to increase those numbers in schools, in medical schools, in nursing schools, in dental schools. And so that's why that is really important. So those admission numbers are very important. And so making sure that we attract our students while they are in elementary school, middle school, and in high school to seek those careers in healthcare. And especially young women. So that is how we turn that tide, so that the issues with infant mortality can be decreased. Because you have to be able to understand that when Serena Williams is calling for pain medication or that she's having issues with breathing, that she's not being aggressive in asking for that. She's saying that she's having an issue. And so that somebody like myself would understand that, where a healthcare provider who doesn't understand that is not going to listen. That's the difference.
I have a question for Dr. Gibson about the
Yes.
grandparents raising grandchildren. Is
Yes.
this just a local organization, or is there legislation to make this more widely?
No, the grandparents raising grandchildren was a Senate bill actually that was passed in 2018. That was across, yes, it was a congressional bill that was passed in 2018. And so the bill that you see that is linked, and the report that you will see was a congressional report that went forward in 2020. And so those recommendations are for the entire United States.
Oh, good.
Yes, ma'am.
Very good.
Mhm.
Thank you.
You're welcome.
Any other questions? Our President Chair, Sue.
I wanted to ask Dr. Mason if she could give us any update on her wonderful book that many of us have read, Born Bright, A Young Girl's Journey from Nothing to Something in America. Her wonderful story of all of the trials and tribulations that she had growing up. If you could comment more on the book and how many of the things that you wrote about in the book, especially your family situation, has changed since 2016, I think, when the book came out. We really appreciated it.
Well, first, I want to thank you all for reading Born Bright. And, you know, when I wrote the book, I really wanted to provide an alternative narrative story about poverty about, single working moms or single moms, and really answer the question about why some people don't make it to the other side of the tracks, or to, and to really provide context and understanding. I do believe that when you share your story, it does increase understanding of a variety of issues, or even, challenge what you think about a particular circumstance. And I also wanted to point away from the individual, and point it towards systems and structures that are often failing families and communities, and to connect the dots. What's been really great is that I think that the work that I do here at IWPR has allowed me to be able to, implement, think about, advocate for some of the, the strategies, what I believe would change the circumstances for women and families. So that's really been really great, I think. In terms of my family, my mom and my dad, when I published the book, they were just, they were not happy about it. But I think they came around and realized, well, this is my story, so they accepted it. But they are both doing really well. And so is my brother. He's doing really well. He has a family of his own. So it was a difficult book to write, I will say that, because, I had to go back in time, but I feel really grateful that I've written it, because like Alotta said when we first got on the call, that it reminded her of her childhood in Texas. And so,
Absolutely.
It was not just my story. It's a story that I knew would resonate for, many, many of us.
Absolutely. Where's your friend Rachel?
She's a CNA. We are friends on Facebook. So I see her all the time, and I see her sisters. And I just want to say, there's a chapter in there called, it's about the drill team I was in. Right. They were at the Super Bowl. They were
cool.
At this past Super Bowl.
Cool.
And I was like, oh my goodness, those are the same uniforms. That we used to wear. There was some version of our uniforms that I used to wear, and so I was just so proud to see them performing at the Super Bowl.
Well, I can tell you, I started reading it and I didn't put it down till I was through. It was excellent. I commend you. Yes.
I would like to ask Dr. Mason to talk a little bit about the wonderful meetings you've got coming up, because I've signed up for them. I know you have one out in California, but it's also virtual. And then I think there's another one. So tell us a little bit about that.
So
let me just say, when you finish, I think Violet Apple has been trying to get in. She's had her hand raised. So provide an answer, and then let Miss Violet ask her question.
Okay. Ms. Violet, did you want to go ahead and answer the question first?
I don't have a question. I just wanted to comment on something that you spoke about. And that was it was really striking to me when you talked about looking at the wage disparity and calculating that as a lifetime thing. So what I did was I went to the internet real quickly, got one of those compound calculators, and I thought, let me just see how this really works out. It's staggering, and you were 100% correct. We need to stop talking about 16 cents on the dollar and talk about what it means over a lifetime. If you just look at it from the standpoint of somebody who is making $40,000 a year, what that actually ends up being, it was spot on with what you were talking about. So it gave me a whole different perspective, and I look at this kind of stuff all the time, but it gave me a different perspective to speak about it, because I think it's much more powerful. Sorry, my phone decided to ring when I was talking, but it's much more powerful when you really give it from that perspective. So I just wanted to thank you for that.
Thank you. And I think if we talked about it like this, if we framed it in terms of like 600,000, $1 million, I think we would be having a different conversation as
Yes.
opposed, because when people think 16 cents, they're like, oh, that doesn't, I can take that or leave that. But when you say, no, this is what that translates to over a career, then
Over 54 years in a career.
Ladies,
of
Dr.
working.
Gibson says she has to leave, so let's thank her and give
Okay.
her a hand. Thank you. Thank you, Dr. Gibson.
Thank you.
Thank you for creating our next leaders of gerontology.
In terms of our events, we have the Power Plus Summit that is coming up. That will be held April 27th through 28th in San Francisco. It's a live event, but you can register virtually. The website to learn more about that, I'm going to put it in the chat. Is powerplus2022.com. But really what we're trying to do is think about these big questions about how do we accelerate women's power and influence? How do we accelerate the closing of the pay gap and, not another few pennies 20 years later, but like, how do we really, what's the thinking that's involved in terms of innovation and strategy? What are new solutions? Like, to be honest, I've been saying, many of these issues, I mean, you all know this, we've been trying to figure them out for like 100 years or for a very long time, our whole careers, your whole careers. And so like, what might we need to be thinking about? How might we think about this differently? Like, what do we really need to do? So that's what we're going to be doing at the Power Plus Summit. And then we have a childcare summit conference that'll be happening in partnership with American University, where we're going to be talking about the future of care. I don't want to mess up the date there, but it's next month. I'll send it out to you all so that you have it. But that's a localized conference. People will be coming from all over, but it's an opportunity. It'll be also be in person, but also be live streamed for us to think about the future of care, both child care and elder care, because women were responsible for both.
Okay. Any other questions?
Just another follow. How old are your twins now, and what are they up to?
They are 12 years old. So they're pretty, they're going to be teenagers, although I feel like they already act like teenagers. They are fantastic. They are thriving, and my daughters and, student government, still playing soccer. My son is still playing soccer, and coming out of the pandemic, like all the other children their age, they're just really good. And that's why I want to say that when we think about single moms and parents, and I always talk about this, but it's not being a single parent that's a problem. It's not giving single mothers the resources they need to be able to adequately provide for their families. That is the issue. And I see that in my own life. Had my mom had the resources, and access to resources for, raising me and my brother, things would have been different. And so, and I know that firsthand because, with my own children. So.
Any other questions? So I guess I have one last question I would ask you. If you had a couple of things that you would say, what is it that motivated you to succeed and get out as compared to all those others that you met and interfaced with while in school and growing up? What was it motivated you? I know you were bright. We know you were bright. But we know you had a mentor. That counselor was a great teacher for you. I could even relate to that because I had teachers that I could call and talk with like that. But what is it you would say made the difference to you?
You know, I think I was really very, well, I did, you know, because I thought about this, like people, you know, and I think it was just I was a tiny bit difficult, you know, in terms of, you know, pushing back against, you know, expectations and, you know, really, you know, working, you know, to try to figure it out, you know, if there was a barrier, like even when, you know, there's a part in the book where, you know, my counselor tells me like, you're not getting to Howard. I mean, like
Yeah,
you're not going
yeah,
And I was like, I don't, you know, that's, you know, I don't know why you told me that. That's kind of rude,
yeah.
but I'm going to try anyway. So that's sort of like, well, I'm going to try it anyway. Try to open this door that seems to be closed. And I think that is sort of one, you know, it's still with me, like even in this role. But I think, and I have to say, I wish that it didn't have to be that way. You know, like I am, you know, difficult, a little feisty, you know, but, you know, I want it to be so that you don't have to be feisty, that those barriers are just not there. You know, you don't have to, you know, have somebody tell you can't do something and then try to prove them wrong. I just want the road to be clear. And so I think that's the only thing I can chalk it up to, was I was just a little feisty and difficult, you know, but difficult in a good way, not difficult, you know, but difficult
It
is,
worked.
you
Yes.
know, and it worked. So I think that's it.
Yes. Okay. Well, do we have any other questions? Because otherwise, I'd like to thank you and Dr. Gibson. I didn't say, but I told you, but my name is Alotta Taylor. I'm a board member with CWI. And I also attended the HBCU. So I can, and I got my PhD at a later date. So I could also relate to Dr. Gibson, but you know, you can do it if you want to do it. So I agree with that. But I also want to thank Miss Sherry Klein. Sherry was another one that organized this. She put a lot of work in. My co-host, she did a great job. And so she's one of those behind the scenes kind of persons, but she is truly a professional and dedicated person. And I want to thank her. And of course, I want to leave this open to our chair and co-chair, Sue or Connie, if you have anything. I want to thank all of the CWI members and all the participants who came today to this Zoom. And we know that the topic was Black women's health, wealth and wellness, but we know it's important for all of us as women to have good health, wellness, and wealth in order to live a good life like many of us are living today. So thank you. Sue, Connie, I turn it over to you.
Okay, I want to thank you all too, Alotta, very much, Nicole and Sherry, and we want to thank you all for the great presentations and what we've learned. What we do is we summarize the meeting and put it in our next newsletter, which will be our March newsletter. And in March, which is Women's History Month, this year, we're going to focus on the judiciary, which is really important. Of course, we'll hopefully have a wonderful nomination of a Black woman Supreme Court justice, and hope that we can get that approved quickly. But there are many other issues with the Supreme Court and all of the court system. And we're going to have some presenters from the Alliance for Justice and from the Leadership Conference on Civil Rights and maybe others to inform us of what we should know and do about making the judiciary more progressive and especially more friendly to feminist ideals. Of course, the reproductive freedom issue is going to be a top area of concern, and one where many of us think that we should be and expanding the Supreme Court and doing other things to create a more balanced court than we currently have. Connie?
I have truly enjoyed this, and I think partly because I've read Nicole's book, and partly because I can identify with Dr. Gibson and the things that she said, and because I'm most of all getting to be old, among other things, but also because she carried so much important information, especially for community awareness. And I think the same thing could be said too, Nicole, for the work that you do, because we have to make women aware. Women are not aware. We have so many hats we wear every day that we don't get a chance to analyze what's really going on until it's too late. So we really need to get women woke, so to speak.
Just want to mention that our next meeting is again on the same date, March 22nd. That's a Tuesday. And our future meetings through June are the fourth Tuesday of the month, unless we have a special circumstance and need to change it. So we hope that you all will join us then. Nicole, do you want to have any closing comments? We want to thank you so much.
I just want to say thank you for inviting me, and I've enjoyed the conversation and the questions, and can't wait to get the summary and see the newsletter because it comes, I'm on the listserv.
You certainly are.
And we'll be sharing your book with others.
Yes.
That's fantastic. And thank you for reading it.
Oh, it's excellent. Thank you. Okay, Sherry, do you have anything you want to say?
Thank you, all the doctors and everybody on the call, and, for your inspiration and strength and sharing what we need to know.
Okay. Well, if there are no other questions or comments, I guess this concludes our program. Thank everyone for participating today. Thank you.